Happy Sunday, and thank you for joining me today. This is part one of 2 episodes I'll be posting today. I've just finished reading the 117-page National Strategy for the Covid-19 Response and Pandemic Preparedness Plan. This is the new national plan from the Biden administration for grappling with the coronavirus pandemic. This is essentially the table of contents in that report. Quote, Goal 1, restore trust with the American people. Goal 2, mount a safe, effective, comprehensive vaccination campaign. Goal 3, mitigate spread through expanding masking, testing, treatment data, workforce, and clear public health standards. Goal 4, immediately expand emergency relief and exercise the Defense Production Act. Goal 5, safely reopen schools, businesses, and travel while protecting workers. Goal 6, protect those most at risk and advance equity, including across racial, ethnic, and rural/urban lines. Goal 7, restore U.S. leadership globally and build better preparedness for future threats. End quote. After the table of contents, there is a letter from President Joe Biden, which essentially addresses the American people and the coronavirus pandemic. It also is very empathetic and pertaining to the 400,000 Americans, now more than 400,000 Americans, who have lost their lives to this pandemic. As I read the report, I highlighted some things from this report. For instance, there has been a lot of talk about invoking the Defense Production Act. We do know that former President Donald Trump invoked the Defense Production Act, but he did not use it in the right way. He didn't use it effectively. There has now been a change in leadership, and this is from the report on how the Biden administration will use the Defense Production Act. Quote, it's past time to fix America's COVID response supply shortage problems for good. The United States will immediately address urgent supply gasp, which will require monitoring and strengthening supply chains, while also steering the distribution of supplies to areas with the greatest need. As new vaccines, testing protocols, and treatments are developed, they will also need to be manufactured in sufficient supply. To respond to this unprecedented operational challenge, the president is immediately expanding emergency relief by giving state and local governments the support they need to make vaccines, tests, PPE, and other critical supplies available for the duration of this pandemic. The president has directed the use of all available legal authorities, including the Defense Production Act, instructing departments and agencies to expand the availability of critical supplies to increase stockpiles so that PPE is available to be used in the recommended safe manner, and to start to fill all supply shortfalls immediately. The federal government will immediately focus on procuring supplies that will be critical to control the spread of COVID-19 by initiating contracts, entering into purchase commitments, making investments to produce supplies, and expanding manufacturing capacity. End quote. So that was from the report indicating what the Biden administration plans to do by invoking the Defense Production Act. On page 26, the report says that we'll see more deaths this month, according to national expert projections. Also on page 26, the report addresses the new COVID-19 variants that we have been seeing. Quote, even as Americans endure a record surge, new mutations of the coronavirus pose the threat of even faster spread. Viruses regularly evolve and at least 4 new variants of the coronavirus have been identified in recent weeks. The United States is not alone in this fight. The pandemic has impacted countries and people around the globe. The virus, including new variants in recent weeks, has laid bare the connections between our health and that of our countries and that of other countries. The variant originally found in the United Kingdom, known as B.1.17, has been identified in numerous states across the country and is found to be 30% to 70% more transmissible. In England and Ireland, the variant has spread explosively despite public health measures. It has been identified in the United States as well. Other variants first detected in South Africa, Nigeria, and Brazil are also potentially more transmissible and could impact the effectiveness of therapeutics and vaccines, or could make reinfection more likely. End quote. According to David Cobbs at CBS Sports, the University of Michigan will now pause athletics for 2 weeks because the UK COVID-19 variant was discovered in their athletic department. In North Carolina, the new UK COVID-19 variant has been discovered as well. The Secretary of the North Carolina Department of Health and Human Services said, quote, "While expected, identification of this COVID-19 variant in North Carolina is concerning, especially at the time when we are already seeing very high number of cases." End quote. This week, we got a press conference. Essentially, we got a public announcement from British officials saying that this new UK COVID-19 variant could be more deadly.
I must tell you this afternoon that we've been informed today that in addition to spreading more quickly, it also now appears that there is some evidence that the new variant, the variant that was first identified in London and the South East, may be associated with a higher degree of mortality. All current evidence continues to show that both the vaccines we're currently using remain effective both against the old variant and this new variant.
If you took somebody in their 60s, a man in their 60s, the average risk is that for 1,000 people who got infected, roughly 10 would be expected to unfortunately die with the virus. With the new variant, for 1,000 people infected, roughly 13 or 14 people might be expected to die. So that's the sort of change for that sort of age group, an increase from 10 to 13 or 14 out of 1,000. And you will see that across the different age groups as well, a similar sort of relative increase in the risk. So that's what we're looking at, but I want to stress that there's a lot of uncertainty around these numbers and we need more work to get a precise handle on it. But it obviously is of concern that this has an increase in mortality as well as an increase in transmissibility as it appears of today.
Under the Trump administration, the coronavirus pandemic was politicized while people were dying. Games were played, lies were told, and public health experts were being essentially sidelined, and were limited to what they could say. It was a disaster. The president also talked about hydroxychloroquine and Lysol. I mean, it was just outlandish. But in this new report, the Biden administration promises truth, transparency, and that their work will be guided by science. Quote, "We can and will beat COVID-19. America deserves a response to the COVID-19 pandemic that is driven by science, data, and public health, not politics. Through the release of the National Strategy for COVID-19 response and pandemic preparedness, the Biden-Harris administration is initiating a coordinated pandemic response that not only improves the effectiveness of our fight against COVID-19, but also helps restore trust, accountability, and a sense of common purpose in our government." End quote. And then it continues, quote, "The national strategy provides a roadmap to guide America out of the worst public health crisis in a century, including 12 initial executive actions issued by President Biden on his first 2 days in office. The national strategy outlines an actionable plan across the federal government to combat COVID-19. The national strategy will guide the activities of the Biden-Harris administration in using all the powers of the federal government to address the COVID-19 pandemic." End quote. In addition, this report also indicates that we won't see Dr. Fauci and other public health experts looking down in disbelief or making faces behind the podium because something the president said. This it essentially promises us that there will be strictly public health briefings guided by public health experts and not the president just making things up. Quote, "The COVID-19 response team will lead a coordinated national response structure across all of the federal agencies of the U.S. government that includes the voices of public health officials. The administration will lead with science and scientists with the Centers for Disease Control and Prevention and National Institutes of Health that are free from political influence, a Surgeon General who's independent and speaks directly to the people, and an FDA whose decisions are based on science and science alone. These public health experts, as well as the president, will communicate regularly with the public and drive a clear, unified, and consistent message that can be carried at the national, state, tribal, and local levels and by the public and private sector." End quote. And so this is very refreshing. I don't know if you saw earlier this week, but Dr. Anthony Fauci described being at the podium in the White House press briefing room without having to worry about any political influence. He described that as liberating. Now that Dr. Anthony Fauci is liberated, he can now appear on any news networks or shows that he chooses. Earlier this week, he appeared on the Rachel Maddow show on MSNBC to talk about the long-term effects of COVID-19.
Some of this stuff, for some people, is very severe. Months after they have, technically recovered from the disease, they're still not able to work. People have long-term and very serious consequences. Is that something that's being studied systematically?
Oh, very much so, Rachel. This is a real phenomenon. I myself personally am dealing and helping a number of people who have a post-acute COVID-19 syndrome, just as you accurately described. They are virologically okay. The virus is no longer identified in them, but they have persistence of symptoms that can be debilitating. Extreme fatigue, muscle aches, temperature dysregulation. Some of them even have situations with what they call brain fog, where it's very difficult to them to focus or to concentrate. Can be really quite disturbing. We are doing a lot on that. We had a workshop in December that my institute sponsored, bringing in experts from all over the country and the world. We're going to make a major investment in research dollars to try and find out the full extent of this, any hints towards what the underlying mechanisms are, what we can do to treat it. We take it very seriously for the simple reason that even if a small fraction, and it appears to be more than just a small fraction of people, have persistent symptoms, when you look at the 24, 25 million people in the United States who've been infected, albeit not all of them have had any symptoms, but even those who have symptoms, and globally, when you have approaching 100 million people having been infected, this could be something that really could be an issue, and that's the reason why we're taking it very seriously.
That was Dr. Anthony Fauci on the Rachel Maddow show on MSNBC. I'm talking about the long-term effects of COVID-19, which is something that's not being discussed widely enough, but that's good to hear that they are working on that. In this new report by the Biden administration, by the Biden-Harris administration, actually talks about that as well. Quote, for those individuals who contracted the novel coronavirus, HHS will establish, HHS is the Health and Human Services Department, will establish a system for monitoring long-term health sequelae and understanding treatment needs, including in people of color. End quote. The Biden administration also lays out how they're going to be tracking COVID-19 data. Quote, the federal government will track national and state data and state-by-state data on a range of performance metrics, including COVID-19 cases, tests, vaccinations, hospital admissions, nursing home capacity, hospital bed capacity, supply chain shortages, and the federal government will establish data systems by tracking COVID-19 outbreaks, future outbreaks across the country, and response efforts to mitigate those outbreaks. The CDC will also maintain public dashboard data at the county level on key COVID-19 related metrics. COVID-19 data with non-personally identifiable information will be open to the public and machine readable to the maximum extent permissible to track performance, support forecasting, ensure transparency, and promote scientific research. End quote. So this shows that the Biden administration is serious. This shows how serious the Biden administration is when it comes to the coronavirus pandemic. And there's a lot of great and informative parts in this report. For instance, there has been a lot of disinformation, misinformation, and conspiracy theories and lies about the coronavirus. Here's how they say they will combat that. Quote, the federal government will develop capacity to quickly identify disinformation and misinformation and work closely with stakeholders to ensure that accurate science-based information is available to the American people. End quote. President Biden also has taken action on the vaccination process, including with state governments. So we won't have what we saw earlier last year with the pandemic, where state governments are essentially just essentially going back and forth, and states trying to come up with a plan and being pitted against each other. This is how that works. Quote, "The president has taken immediate action to implement Goal 2 of the national strategy by directing the initial actions across necessary to convert vaccines into vaccinations, including improving allocation, distributing, tracking, and support to state governments. The United States will spare no effort to ensure the public can get vaccinated quickly, effectively, and equitably. To meet the aggressive vaccination target of 100 million shots by the first 100 days, the federal government will work with states and the private sector to effectively execute an aggressive vaccination strategy, focusing on the immediate actions necessary to convert vaccines into vaccinations, including improving allocation, distribution, administration, tracking, and support to state, local, tribal, and territorial governments. At the same time, the administration will mount an unprecedented public campaign to build trust around vaccination and communicate the importance of maintaining public health measures such as masking, physical distancing, and contact tracing, even as people receive safe and effective vaccinations." End quote. There's also some news here in this report. It says that by February, there will be 100 federally supported centers across the nation for coronavirus vaccines. It says that this will be a coordinated effort by the Department of Defense, who will bring logistical expertise and their staff. Also FEMA, who will manage setting things up and operating. Also mobilizing thousands of clinical and non-clinical staff and contractors, including federal medics. According to this report, the staff from the Department of Agriculture and Department of Veteran Affairs will be present. There will also be people from the Public Health Service Commission Corps officers and personnel from the Department of Defense. Quote, "who will work hand in glove with the National Guard and state territorial, tribal, and local teams," end quote. This report says that the Biden administration will also partner with tribal nations to advocate effective and equitable vaccination programs. It says that President Biden has asked Congress to render additional funds to the Indian Health Service to support extended health services, support testing and vaccine efforts, and address lost avenues. The Biden administration will also reach out to U.S. territories and freely associated states, including Puerto Rico, when it comes to distributing, transporting, and getting these coronavirus vaccines to communities effectively, fairly, and timely. They will also work to build public confidence by working with the CDC and other public health experts to ensure Americans are reading scientific-based information about the coronavirus vaccine and not conspiracy theories and being fed misinformation and disinformation. If you remember last year here on this show, there was lots of public reporting. I talked about this on the show as well, about Russia and North Korea trying to hack and view our vaccine information and what we're doing. Well, the Biden administration now has a plan for that. Quote, "The U.S. government will counter any threat to the vaccination program. To do so, the Director of National Intelligence will lead an assessment of ongoing cyber threats and foreign interference campaigns targeting COVID-19 vaccines and related public health efforts. The U.S. government will take steps to address cyber threats to the fight against COVID-19, including cyber threats on COVID-19 research, vaccination efforts, the healthcare systems, and the public health infrastructure." End quote. This is great news. When President Biden was the president-elect, he said that he would request this of all Americans, and it is in this report. For these first 100 days, President Biden is asking all Americans to wear a mask. According to this report, 35 states and Washington, D.C. and Puerto Rico have mandatory masking, but remaining states essentially never or sometimes require masks. Furthermore, the Biden administration will work with governors to determine their needs and work to safely reopen schools, and businesses, and travel while protecting workers as well. They will also expand mental health services, which is great because mental health has not been discussed a lot over the course of this pandemic, but it has been exacerbated. If you have been listening to this show for a while, especially over the course of this summer and starting last spring, you will recall the reporting that I did on the coronavirus in immigration detention facilities and in prisons. Well, the Biden administration says that they will now address that and make sure those places are adhering to the public health guidance. Here is one last thing from this report that I feel is worth noting here. Quote, COVID-19 outbreaks are likely to occur in the United States and globally for years, even after the introduction of a safe and effective vaccine. During the Biden-Harris administration, it is likely that other biological events, including the potential for another high consequence or pandemic event, will occur. The United States must strengthen its capacity to swiftly counter potentially catastrophic biological events. End quote. So that is essentially essential here, because we have now been alerted and informed that we may potentially experience another pandemic or extreme public health threat. I mean, even though it's alarming and scary, it's also good that they are telling us this. So when it happens, we are not freaked out or astonished because it's here and it's in black ink. It is clear that this may happen. If you don't want to read the full report like I did, then here's how Mackenzie Bean encapsulates it at beckershospitalreview.com. Quote, 1. President Biden signed an executive order on January 21st to require masks on planes, trains, buses, and in airports, according to the New York Times. The order also implements mandatory quarantines for international travelers. These actions build on the executive order President Biden signed on his first day in office, requiring masks in all federal buildings. 2. Another executive order will create a national testing board tasked with developing and quickly scaling up new rapid tests for COVID-19, according to CNBC. 3. The president's pandemic plan also instructs HHS to collect data on school reopenings and COVID-19 spreads to produce more research into the risk of sending kids back to school. 4. President Biden will establish a COVID-19 health equity task force to ensure COVID-19 vaccines, treatments, and other supplies reach communities of color that have been disproportionately affected by the virus. 5. Through another executive order, the president will also create a drug discovery and development program that will continue research into potential COVID-19 treatments and emphasize more diversity in clinical trials. 6. Another action aims to improve federal data collection and sharing. The order instructs the CDC to create a dashboard detailing county-level COVID-19 cases so people can better assess the level of transmission in their own communities. 7. An executive order called a Sustainable Public Health Supply Chain outlines the president's intentions to use the Defense Production Act to compel companies to manufacture supplies needed for the nation's pandemic response. 8. As part of the pandemic plan, the federal government will start fully reimbursing states for the cost of using the National Guard to aid in pandemic response activities. 9. Another executive action instructs the Occupational Safety and Health Administration to immediately release guidelines for employers to protect their workers' health and safety. And finally, number 10, the Biden administration proposed a $1.9 trillion COVID-19 relief package last week. White House officials said they would need much of those funds to enact the president's pandemic response plan, according to the New York Times. End quote. So that is it summarized for you there. So there's a report summarized for you in just like 10 bullets. According to NBC News, experts are adulating President Biden's COVID-19 plan, but warn that undoing Trump-era mistakes will take time. Dr. Ashish Jha, dean of the Brown University School of Public Health, said, quote, "The single most important thing that the Biden administration needs to do is fight the pandemic and communicate honestly and openly with the American people about what needs to be done." End quote. The new CDC director, Dr. Rochelle Walensky, has promised to tell the truth even when it's dark. As far as states in the midst of this dark pandemic, South Carolina is continuing to report high coronavirus numbers. And according to the CDC, we are among the last in the nation when it comes to vaccine distribution. Our governor says he is frustrated by that news, and he also writes on Twitter, quote, "While I'm glad to see there has been great progress, we still have much to accomplish in getting South Carolinians vaccinated, and I know we can get it done." End quote. Yesterday in Oklahoma, they reported 4,157 new coronavirus cases and 44 deaths. Also in Oklahoma, funeral homes have been strained because of the coronavirus. One person saying December was, quote, crazy. They also go on to say, quote, "There's been a lot of overtime. Our directors, our entire staff have been absolutely stretched." End quote. We are seeing a rise in coronavirus cases and deaths, hospitalizations all across the nation. As a nation, we have now surpassed more than 25 million coronavirus cases and more than 417,000 deaths. That's more deaths than in the Korean War, than in the Vietnam War, than in World War I and in World War II. Earlier this week, to honor the 400,000 dead, then President-elect Biden orchestrated for there to be a ceremony for them. It has been a long week, and we have just surpassed an unbelievably high death toll as a nation. Dr. Anna Stratis, who worked in New York during the disastrous first wave of the coronavirus pandemic, she joins me next. Stay with us.
In this world where people are staying at home, many of life's moments are being put on hold. At Carvana, we understand that for some, getting a car just can't wait. That's why the new way to buy and sell a car is also the safer way. At Carvana, you can do it all 100% online from home, with a touchless delivery and pickup process to keep you safe. And for even greater peace of mind, all Carvana cars come with a 7-day return policy. So if you need to keep moving, it's our goal to keep you safe. Check out Carvana, the safer way to buy a car.
Welcome back. Joining me now for the interview is Dr. Anna Stratis. She worked in New York during the disastrous first wave of the coronavirus pandemic in April. Dr. Stratis, welcome back, and thank you for coming on the show.
Oh, it's a pleasure, Jeremiah. I've been wanting to catch up with you. So much has happened.
Yes.
It's a new day.
Earlier this week, the U.S. surpassed 400,000 coronavirus deaths. How does that make you feel as a frontline healthcare worker?
I can't believe we've allowed this to happen.
Mm-hmm.
Yeah, I can't believe we've allowed this to happen. There's no words. There's no words. There's political infighting and all these charades going on, and people are dying.
Yeah. When the ceremony was held to honor the 400,000 lives lost, orchestrated by then President-elect Joe Biden, how did you feel as you were watching that?
The memory of it was actually the elect and, the memory of the lamps along the mall, and just imagining that those are thousands, those stand for 10,000 lives, one lamp, and just that brightness in the dark and everything that those lives have sacrificed to teach us. It's an unforgivable moment. It's a horrific moment, and it's a moment that history is going to remember, just like, when we learned from the millions of horrific deaths in Nazi Germany. Yeah. And still to this day, almost 100 years later, we're remembering what happens when we allow authoritarianism, populism, xenophobia, racism to come in and to take the place of the preciousness of human life.
Yeah,
that's what was on my mind.
On Wednesday, Joe Biden was sworn in as president and got to work immediately. He has taken a lot of steps already on the coronavirus, including crafting together our first nationwide plan for the coronavirus and the vaccine rollout. Are you relieved and jubilant as that this is finally happening?
I mean, and it's totally unforgivable. It's unforgivable for them to go into Washington and realize, there never was a plan. I'm jubilant that the CDC is ungagged. Remember, we talked about how I think the CDC can get back to work in terms of making the policy statements that I think it's a return to listening to scientists.
Most definitely.
So that's exciting, but it's shocking that there was not a plan before this.
Mm-hmm.
Yeah.
We are beginning to see these different COVID-19 variants emerge around the world. There is a UK variant, which is described as being more deadly, in the South Africa variant. What does this variant do, and should we be concerned about this?
So again, my apologies, I'm not a virologist, but essentially the coronaviruses are known. I mean, there's 4 of them that circle the globe every year, and they cause sniffles in kids and so forth. This is a vastly new variant, which is why it's wreaking such havoc. But my understanding is that the coronaviruses will mutate and shift, and that's kind of the way that that's sort of their MO. So to hear that there's new variants popping up doesn't surprise me, because as I understand it, we're probably going to be looking at this COVID-19 strain for a while, probably for years to come. It's kind of now going to kind of be part of our population. We'll probably be vaccinating for this perhaps we're going to be boosting this like the flu shot, because there are going to be significant shifts in the makeup where we may need to sort of kind of prime our antibody response or our immune response in a different way. I think it's going to be part of the population. I think it's going to be something we're going to get regularly vaccinated for. So I'm not too worried. The other thing too is they haven't seen any issues where the current vaccine is not able to keep up with these current variants.
Okay.
I suspect though in years to come, there's going to be such significant shifts that they may need to rejig the vaccine, just like the flu shot we get every year, because the influenza virus keeps mutating as it circles the globe.
What do you make of the unvarnished and liberated Dr. Anthony Fauci as he was making his appearance for the first time, looking very relieved earlier this week?
You know, it's funny. Me and my husband were just talking about this, how every press conference with Fauci pre-Biden was just his head in his hands all the time. I mean, it must be really nice not to have to sit in a press conference and hear the head of state talking about hydroxychloroquine when the science has already debunked it. So God, it must be relieving. I imagine if I were his physician, his blood pressure must be down, his stress levels, his sleep must be better. Yes. He's living his best life right now.
The new CDC director, Dr. Rochelle Walensky, is telling us that we can expect 500,000 dead by mid-February. Dr. Fauci said that we can expect to get back to some normalcy maybe sometime soon. Should we expect as a society to essentially be living with the coronavirus for a while before we can expect normalcy?
Yeah. I'll tell you what so I admit I was pretty naive until I became a vaccinator, until I served a vaccinator shift here in New York City. So when I heard about millions of doses being, released, and I thought, well, that's easy. Just put them into arms, 1 million, 2 million, 5, 10 million. It took me 11 hours of working almost without breaks to get 90 doses in, 90. So, and I'm pretty quick. And I think that I was probably as quick as anybody else in the center. Like our entire center in a school in the South Bronx, which had about 20 people vaccinating, we probably on any given day, 1,300 doses for like an 11 hour, like just going straight. So imagine how many centers you have to be running for how many days. That's about, 100 days to get, something around 150,000 people. There's 8 million people in New York City. So I all of a sudden realized the complexity of having to do a mass vaccination campaign. We are going to have, Israel is the only country that's really got this. They are, the army is deployed. They've got mass vaccination centers. We have to convert our stadiums, Disney World, What I would say is return to normalcy is going to depend on how fast we can get shots into arms. And it's not going to be on a small scale. We have to go hard or go home. And if we keep going at the little measly pace that we're going to be looking at 2022. But if we can actually get our butts in gear, and I know that you were saying different states are, getting vaccine delivery at different paces. We've all got to roll up our sleeves, get the community centers, the schools. I'm a volunteer. New York City has a volunteer medical corps, which I'm part of. And when I'm called, I just show up and I will serve my time free of charge. And a lot of doctors and nurses will do that. So get going.
What do you say to those who are sort of hesitant or reluctant to get the vaccine just because of the politicization of the coronavirus vaccine and some of the other things that happened under the Trump administration.
Yeah. I mean, the problem is there was so much misinformation that it's so hard to walk that back now.
Yeah.
Once you instill a doubt in people's mind about vaccines, then they run with it. And then there's all sorts of sort of weird stuff on the internet that will support these false claims.
Yeah.
The long story short is I have reviewed the science. I understand the years, decades of work that have gone into mRNA vaccines. I understand that the coronavirus provided this fabulous opportunity to bring these vaccines into play. And the FDA created this, just took all the red lights away and just allowed this thing to fly through. So as I think we talked about, we saw vaccine delivery or vaccine development happen on the timescale it should. So let's do this for Ebola. Let's do this for, let's put renewed effort into a vaccine for HIV.
Oh, yeah.
So let's do everything like at this pace. Do I trust it? Absolutely. I've been administering vaccines. People have walked away just fine. If they're looking at, I think the CDC is looking at numbers of, 23 odd anaphylactic reactions in 1 million doses given, which is, it was more than that, like several million. So it's about an 11 per million anaphylactic reaction. And in the US, there were no fatalities because again, I'm vaccinating in a center. There's 2 EpiPens 10 feet away from me, and there's a bunch of doctors and nurses in the room, and we keep people in the room for 15 minutes, sometimes 30. So, and if you're going to have a serious reaction, we've got the EpiPen to mitigate any serious complications. So I'm a hell yeah for this vaccine. I'm a hell yeah. And if I may say, there was my most inspiring conversation at this vaccine camp was a young woman. She came up, she's a Black woman, and she said, I'm really cautious about this vaccine because of the history of oppressive medical experimentation in this country against Black and people of color. And she said, I want you to tell me that this, in your view, is not some sort of medical experiment, that this is not another thing in the legacy of this dark legacy of this country. And we had a long chat. And I told her, look, as far as I can tell, this vaccine is something that's been developed with adequate and equitable and ethical testing on folks, Black, Latino, and all folk of color and white folk. And it seems to have equity on its side in the development. And what I do know is that in my personal view, I saw people of color dying disproportionately of COVID-19. The death rates are 3 times, at least 5 times that of white folk. And so when, and she went away, she got the vaccine because she said, I want to protect my parents. I want to protect my family, my uncles and my aunts. And so what I would say is I think this vaccine is an opportunity to make right on the vast inequity that we see coronavirus, the toll that it's taking on communities that are already behind the 8 ball. For me, the vaccine is something that's helping to level that inequity.
President Joe Biden has promised to vaccinate 100 million Americans by in his first 100 days. Looking at the current speed right now, Mooney State's saying it's going to take 10 years to vaccinate all of us. Do you believe that is a conceivable goal and that we can accomplish it?
It is, but the problem is the prior administration did this whole feds versus state thing, and there's no concerted effort. Just like you mentioned, where you are is, there's little point in making a federal announcement when the states are sort of willy-nilly doing whatever the hell they want. And there's nothing short of mass vaccination camps with military deployment to get this done. And so if we're, I'm afraid to say, if you want to get this done, it's big time. It's like, look at Israel, look at how they're doing this. Like there's nothing short of Israel's deployment that is going to get this job done. Shots just won't magically fly into arms.
We are beginning to get more reporting on the long-term effects of COVID-19. For instance, some people experiencing this, some people not, after they have contracted COVID-19, experiencing these long symptoms. will that affect them for the rest of their lives? And could that ultimately lead to death?
Gosh, that's a great question. I don't think these are fatal, but the problem with me is that it's long term.
Hmm.
If we're talking about fatigue, some neurological side effects, these are things that people keep people out of work. They ruin relationships. They enact a huge toll in medical bills, right? Because they're not
Yeah.
going to get coverage for all those MRIs and those neurology specialty appointments and stuff. I feel that this is going to be like this lost group of people who just after the whole hoopla of COVID passes, they're going to be left without any advocacy, like the 9/11 survivors, right?
Yeah.
They're kind of going to be left in the dark. And you know, will it be fatal? No, but will rates of suicide or substance dependence increase in folks who are having these long-term symptoms for which nobody seems to care? Yeah, and that's gravely concerning.
I also wanted to speak with you on the mental health aspect of the coronavirus.
Yeah.
What can we do to address this more as it's been exacerbated under this crisis?
Yeah. It really, it's just something we're paying lip service to, right?
Hmm.
It's not that we can, you know, set up helplines and, you know, right now the problem is that we're trying to get a virus under control and we're trying to pay lip service to the mental health. We're trying to we're trying to bring down death rates, but we're also trying to minimize lockdown procedures because lockdown leads to adverse mental state.
Hmm.
I feel like, to be honest, I'm not optimistic about this because what's going to happen, I mean, people are talking about the delayed effects of this will last years, maybe a decade, maybe, you know, they speak of lost generations, people who are at critical points in their life right now. They may be at a critical point in school. They may have just graduated. They may have had their college interrupted. So I'm afraid to say that this may be something, this epidemic of mental unwellness that may stretch for decades. I know I don't paint a nice picture on this, but this
Yeah.
is a catastrophic event in our globe.
It certainly is. The United States is continuing to report more than 200,000 coronavirus cases. What can we do necessarily to curtail the exponential increase in cases and deaths and hospitalizations that we keep seeing?
Yeah. Well, it's the family gatherings and it's people thinking that they can kind of gather and that nothing's going to happen to them. So in my own family, my family in an unnamed state that shall go unnamed, they kind of got together. And there was a picture on Facebook of them all, you know, gathered and they looked happy and so forth. And we checked in and the whole family got COVID. And I spoke to a colleague of mine, same thing. Her entire family got together for the holidays and got COVID.
Wow.
There's this complete denial that this can happen to you. There's this thought of like, oh, we're a good family. We wash our hands. I don't know, when we hug, we look the other way. Some I've heard all of these ridiculous things. And I'm kind of thankful now that it's this long stretch without holidays. This is kind of the darkest part of the year where we really don't have any holidays. Healthcare workers are hoarse. We are literally sick and tired of telling people to stop gathering as families. So please just stop gathering. Me and my husband spent an extremely boring, isolated, lonely experience over Christmas and New Year's. We're in New York City. New York City is kind of dead at the moment. We have no family around. We did not have any travel plans. We were twiddling our thumbs for the entire time. And it kind of makes me a little ticked off that, like, you know, everyone's like, oh, but we haven't seen family in years. I had the saddest holiday season, but I knew that I was doing it for a cause. So guys, come on, pull up your socks, be sad and lonely with us. Come on.
Same thing happened with my family, our other family back across the country. We essentially we stayed home and we just FaceTimed them for Christmas. And Dr. Anna Stratis, thank you so much for coming on the show. I really appreciate it.
Absolutely. Well, let's be lonely and isolated, but you know, hopefully very soon we'll be back. As I give all my vaccine doses, I'm like, okay, don't lick any subway poles right now because you need your second dose. But hopefully in the months to come, we'll get you back on the beach.
Yes, most definitely. Thank you again, Dr. Stratis.
All right, Jeremiah, take care.
All right, we'll be right back.
Oh, I wanted to ask you, Liz and I are going to do some work around the house. Do you know any good contractors?
I might.
Oh, that's great. Can you check their qualifications? Make sure they have great reviews and research the average price for the job. Oh, and book them on Wednesday. Actually, make it Friday. But when the water.
You can't expect your neighbors to do everything HomeAdvisor can. So for a better way to get home projects done right, just ask HomeAdvisor.
Welcome back. Here at the Jeremiah Patterson Show, we have been following closely the status quo of Alexei Navalny. Reportedly yesterday, there were thousands of people in Russia protesting for his release, his immediate release from prison. We know that the Biden's national security advisor, Jake Sullivan, has called on Putin to release Mr. Alexei Navalny. This was an NBC News report last night.
Tonight, stunning scenes across Russia. Tens of thousands taking to the streets in a massive show of support for Russia's jailed opposition leader, Alexei Navalny, President Putin's most vocal critic. His lawyer carted off by riot police while addressing the media. Scuffles breaking out in some places, with protesters beaten and bloodied. Demonstrators lobbing snowballs at police. More than 2,600 people were arrested, including Navalny's wife, Yulia, who was later released. Navalny himself remains behind bars after his dramatic airport arrest Sunday, returning home to handcuffs after months in Germany recovering from nerve agent poisoning that nearly killed him.
Has something just changed in Russia?
What we are seeing now is a real change. We're seeing a birth of new feeling.
Tonight, Navalny faces an uncertain future. The Biden administration has called for the immediate release of him and the protesters. Sarah Harmon, NBC News, London.
Just an update on the arrest number. They reportedly now more than 3,000 people have been arrested in Russia in connection with these anti-Putin protests, in connection with these protests, immediately demanding the immediate release of Putin critic Alexei Navalny. Thank you very much for being with me here on the Jeremiah Patterson Show. We will continue to follow this story here on the show. It is a remarkable story. It is a fascinating one. We will keep our eyes on this. Once again, thank you so much again for listening. Please make sure to share this episode with your family and friends, and I'll see you later today.